there. Welcome back to the Complicated Kids podcast. I'm your host, Gabriele Nicolet. I am a toddler whisperer, a speech therapist, and a parent coach. And today I have Jaclyn Pederson with me. Jaclyn, welcome.
Thank you for having me. Really excited to be here.
I'm going to let you tell us about the place you work, but I will say the organization that you work for is called Feeding Matters. And so, as people might guess, you all think about feeding children a lot.
All things feeding children, for sure, especially beyond picky eating.
So tell us a little bit about what the organization does, and then we're going to get into your story and kind of what people need to know about picky eating.
Sure. So Feeding Matters is a nonprofit organization. We are headquartered in Arizona, but we serve the United States and even internationally. In a lot of cases, our programs reach many different countries across the world. And we are an organization that is committed to advancing the field of pediatric feeding and pediatric feeding disorder. And so we do that through many different ways, but one of the things that's core to our organization is supporting families who are going through the challenges that come with pediatric feeding disorder. So we support families, provide them with information, access to resources, access to providers, and then we also help educate professionals, just because it is something that not a lot of professionals know about. Even at the pediatrician level, they're only getting 3 hours of nutrition. And at the graduate level, for a lot of our healthcare therapists, they're not getting a lot of information either. So we really help to support and educate professionals as well. And then on a broader scale, we need to change the system. Oftentimes families who are calling us, we know they're faced with a system that doesn't believe that this is a real issue, that may not want to pay for it, that may be complicated in order to get in to see the right people or who to see the right people, because the system is a little bit so broken. So we do a lot of that. And then raising awareness is a huge part, especially because a lot of times people think that what is picky eating is often maybe something more.
Yeah, and we had, I want to highlight a couple of past episodes, one with Jenny Friedman talking about picky eating and extremely picky eating. And there are different ways, and I think part of your mission at the organization is to kind of codify these terms a little bit, bring them into an umbrella of pediatric feeding disorders.
Yes.
We also hear the term, and I know you mentioned it before we hit record, ARFID. Can you talk a little bit about what is the difference between picky eating, extremely picky eating, if we're going to go there, and ARFID?
Yeah. So I think you're right in the sense that there are many terms that are floating out there, and that makes it really challenging to get the care you need, especially as a parent. You know that something is wrong at mealtimes. You don't know what it is, and you're trying to talk to your healthcare professionals and say something is wrong, but I don't know what it is. And we need them to be able to say, okay, I know what it is, but right now they have 10 different things to call it. And so, what the effort that we did, and maybe I'll back up a little bit and talk about the origin of PFD, because I think that's a critical piece to then talking about the differences and the similarities of all of these different conditions. So for years, Feeding Matters has been around for 18 years. And so for years, we have been around trying to talk about how important it was to pay attention to feeding struggles. And that's what we would call it. We were founded by a mom who had triplets born 14 weeks premature, who realized that even though she expected medical complications, feeding them was the most challenging thing that she had ever experienced. And even though she had the resources to fly across the country to try to get them the support that they needed, she still was met with barriers, and she realized that no one is talking to one another. So that's kind of our origin story, is we need to bring everybody together. And so we really think of ourselves as these conveners and facilitators of system change. And so we did that in 2016 by bringing experts together across the country and a few international experts to say, hey, we're all calling this 10 different things. Every discipline is seeing this show up in their waiting room. Can we think about this holistically, and can we name it, and can we build an identity so that families feel validated and what they're experiencing is real and valid and has a name, and professionals who are trying to treat this actually have some validation to their work too, that this is a real specialty. And
Okay,
so,
pause. There's so much I
yeah,
want to say here because also codes. Also, right, as healthcare providers, and part of, I mean, I don't do it anymore, but part of what speech language pathologists, for example, or any feeding therapist, occupational therapist too, what they're grasping for is a code that they can put on a bill, on an insurance claim that will get reimbursement for families. I mean, that's all, and I know I'm skipping ahead a little bit, but like that struggle is real.
very real.
And then that gets into what I said before, where you hit record also, which was like, I don't even know how you deal with health policy. It overwhelms me immediately. I'm like, oh God. But okay, there's something else that I wanted to go back into. What you were saying was, okay, first of all, can you give us, so I already threw out 3 of them. What
Yeah,
are some of the other things that people were seeing? And by the way, sorry, I know I'm looping here,
that's
but
okay.
when families go to the pediatrician and they say mealtime is a struggle, do you have data on like what percentage of, and I don't want to throw pediatricians under the bus, but like the first person that parents are going to ask these questions are saying it's normal?
It's a great question. We know that feeding is one of the top concerns that's brought up during
Mhm.
pediatrician visits outside of, your common cold and well visits.
Yep.
Um, I don't know that we have studies that quantify,
But certainly families that you're talking to express
but
this.
it's a very common thing for families to say, I expressed this from day one.
Yeah, yeah.
And
And
that's what makes it challenging.
yeah, yeah. So there's
Mhm.
like a lack of kind of belief, which I think is true, by the way, of most developmental conditions. Parents
Yeah.
know
Mhm.
before anybody else.
Parents know before anybody else.
And
Yeah.
so they're having this sense, feeding's not going well. Like everybody says this is supposed to be easy. I'm doing baby-led weaning or I'm doing whatever process is in my book that I bought, and it's not going well.
Yeah.
And so, okay, so now answer my question. I know I'm, again, looping around. What are some of the other terms that people are throwing around
Yeah.
under this
So,
umbrella?
well, I think the one that is really challenging for a lot of families is to call kids picky eaters because I think it puts the onus on them and it doesn't allow for any space to quote unquote adapt the problem to get it to be a more functional space. I think that you've heard things like feeding difficulties, feeding problems, feeding concerns, feeding challenges, um, growth faltering, failure to thrive are terms that are thrown in there that often are, um, like the effect of having feeding concerns, difficulties, disorders, like any of the different terms. And then each discipline has their perspective too. So that's where we do see Fed was published in 2013, and that was an expansion of feeding disorder in infancy and early childhood within the medical health handbook. So the DSM-5, when it expanded from feeding disorder of infancy and early childhood, expanded into ARFID, that was a very like psychology and mental health perspective thinking about feeding. Whereas you had in the SLP world, they were seeing swallowing. And so you had dysphagia. And so it was all of these different perspectives, just looking at it from their own silo, from their own discipline, and not always thinking about it holistically. And so what we did when we gathered everybody together was we said, we know you've got these different diagnoses, but all of this needs to be seen more broadly, and it's a function of life. Feeding and eating is something we all do. Um, and so they named it pediatric feeding disorder, and they built a conceptual framework. And that conceptual framework really overlays on this framework that is taken from the international fields, and it's called the International Classification of Function, Disability, and Health. And it really looks at especially in the United States, we're used to thinking about things in a disease state, and we just need to medicate or fix the disease. But the ICF is really nice because it thinks about things almost as a spectrum
Mm.
and a method of like, okay, when something isn't functioning, what do we need to do to get it functioning? And what are the different reasons why it may not be functioning? And that's what I really love about the framework that is pediatric feeding disorder, because it's defined as when a child really isn't eating appropriate for their age, and where they may have dysfunction in any one of 4 different domains. So in the medical domain, we may have some food allergies present. We may have undiagnosed eosinophilic esophagitis present. We may have some GI challenges that we're working through. All of that is really painful. All of that has a lot of symptoms with it that make eating not pleasurable. And so when a child may be showing pickiness, they may just be saying, this is hurting me. And it's because we haven't figured out why. And there is a medical thing that's going on. And so
And
yeah,
because if
yeah,
you're a baby and this is happening to you, you have no way of knowing that it's not normal, number one, because you only have lived in your body, right? And not for
yep,
very long.
yep.
And you don't have any communication skills
No,
other than your behavior
other than your behavior.
to indicate that eating is unpleasant, painful, leads to an effect that is impeding you in some way. And so, and I think particularly as regards young children, because we expect them to be developing, typically, which is a reasonable expectation, but when then they are demonstrating pickiness in air quotes, our first response is to go to a behavior response instead of going to look at the medical side. And we do kids a disservice. And I know I have done this also in the past before I learned about what is it called?
EOE.
EOE, thank you.
Yep. EOE is a big one.
Esophageal eosinophils. I mean, that in and of itself is another one. I mean, constipation we can talk about too, in terms of what's going on in the GI tract that is impacting what kids are putting in their mouths.
Yeah. And we don't want to eat when we don't feel good.
Right.
And that's a kid too. That's an infant as well. And that's a baby. And so that's why the framework is really important, that like when there is an indication that something isn't developing as you would expect, we need to be thinking about it holistically.
Yeah.
And so that's the medical domain. The feeding skill domain is another one. We don't think about our feeding development milestones. We are tracking when our kids are saying their first words and when they're crawling and when they're walking and when they're pointing at things. But the only questions we get asked about their feeding development is, are they feeding themselves? Do they have a spoon? And oftentimes offhanded questions when a pediatrician is rushing through an appointment. And because it's not part of expected developmental domains, there's not a feeding developmental domain that's a part of early childhood development.
Interesting. I hadn't thought about it before either, right? Because that stuff gets broken down into oral skills or manual skills.
It does.
And not so much, right, feeding skills per se.
Yeah. And so we've gotten too narrow and we need to pull back and think about feeding as development, because there are so many skills and the skill development that's happening. It takes us, without any interruption, 7 years to learn how to eat. And people just think that that's expected. And it takes us 7 years to learn. And then even after that, we are still refining our feeding skills. And that research is coming out every day now. When we first started at Feeding Matters, we thought it was like up till 5, but you're not giving steak to a 5-year-old. And it's not just their act of chewing and swallowing. It's, can they choose the right bite size? Can they get it onto a fork? Can they choose the food that they are wanting? And is it making its way through their body in the right ways? And so that's the feeding skill domain. So if there's any disruption in the feeding skill domain, then we need to look at PFD as well.
Mm-hmm.
And then the nutrition domain is often a consequence of the other 2 domains, which is like, if I have GI problems or I can't chew very easily, and so I'm only going to choose chicken nuggets,
Yep.
then just going to do that. And what
Or
I
a
do
pouch.
here, or a pouch. Yeah, those are like, we all have accommodations to our needs.
Mm-hmm.
And so we need to peel back the layers and have a better understanding of why the accommodations are needing to take place in the first place, because PFD has a lot of comorbidities.
Mm-hmm.
One of the primary comorbidities of PFD is autism.
Mm-hmm.
And a lot of times it's assumed that autistic individuals also have picky eating. But often it's pediatric feeding disorder, and it can look many different ways. And so it's not just that there is a preference for a particular type of beige food. It's why is that a preference? Is it easier to chew? Is it easier to digest? Do we need to be thinking about all of the different things involved? And that's where it leads us then to the psychosocial domain, which for us in PFD is a very important part, because not only are you developing your feeding skills throughout your early childhood, you're also developing your relationship with food.
Yeah.
And so negative experience after negative experience is building a framework and a domino effect for what then we are now seeing show up as ARFID. So if you've had a lot of trauma in your history and you've been called a picky eater, or you've had to try to grow and gain weight and it's just not working, or you've had something that's underdiagnosed or missed, then you may be showing up as like a 9-year-old that looks like you have ARFID, but we need to also know that maybe that started as PFD, and make sure that we know, is there something medical that we missed, or are we really working on, the psychology drivers of feeding?
That's so
So I kind of took us in
fascinating.
many different directions, but that was an overview of all 4 domains of PFD.
Well, and it's necessary. And I'm assuming sensory is with in there with motor.
Yep. So feeding skill really includes like sensory
Yeah.
experiences. And I
Because,
think that's where it gets into like all the domains are a dynamic system. So they work together.
well, and this is the thing. I mean, I tell kids this all the time. I tell their parents too. It's like your mouth, let's say you have a sensory processing disorder, you're tactile defensive. You're not getting good signals into your brain from about what your body is touching. So what that looks like on the playground is maybe I've got my hands, up by my shoulders so they don't touch anything, or maybe I'm very visually hypervigilant. So I'm watching everything that my hands are touching, and if I see a little speck of dirt on my hands, I'm gonna wipe it off, and I can kind of regulate that way. So that's how I'm managing, right, with my visual system to override my tactile system. There is no way for you to see into your mouth, right? And so I guess we could sit somebody in front of a mirror, but even then, if you're trying to chew and swallow, you can't see what's happening in there. It is a black hole of information. And if you're getting bad information, these are kids I see a lot, is the sensory motor kids. And I do think that sensory component in autism is also for
Very
sure
prevalent.
playing in there. It's very
Yep.
prevalent, right?
Yep.
And so you're getting all this bad information. And so, of course, if you don't know what the next blueberry is going to taste like or where it's going to explode in your mouth, you are not eating blueberries.
And it won't feel safe.
And it doesn't feel safe. That's right.
Mm-hmm.
That's exactly it. Yeah. So, okay. So I just wanted to go back and like make sure we put sensory in there, because I think we forget that
Well, and that's been, so since PFD has come out, it's really nice to be able to turn it to the medical community and say, like, what do you think of this? And so, it was published in 2019 in Journal of Pediatric Gastroenterology and Nutrition. We did advocate to the CDC to make it its own diagnostic code. So there is PFD acute, PFD chronic, but then researchers have taken it, and it's been in many different research papers. And one of them is actually like pulling out sensory from feeding skill and psychosocial and making its own kind of domain. And I think that's a really interesting thing. And both ARFID and PFD are still very new fields. ARFID coming out in 2013, PFD coming out officially in 2019, being a code in 2021, it's still a new field. And so we need to be researching this, and we need to be understanding it better. What we hope to be a part of that conversation in is making sure it's more family centered, and making sure we are doing research that is family centered and patient centered, and really advancing this field in the right ways, because there's so much that needs to be understood and known and researched.
And so I want to bring it back to the families. You have had your own experience. So you worked at Feeding Matters first.
Yes.
And then your second son was born.
Mm-hmm.
And do you want to walk us through that a little bit?
I will. And I may even go back to my first son, Charlie, too, because I think it's been a really interesting lesson for me in many different ways. I started at Feeding Matters without being married or anything. And then I over the years, learned more and more about pediatric feeding disorder and all of the feeding needs that children have. and just fell in love with our mission at Feeding Matters. And especially like my background is all about like health innovation and systems practice and like managing nonprofits. So it's very far away from my like any sort of expertise, but I've learned a lot about this system, and this system does need to be fixed. And so that's what I find the most challenging and interesting about my role. But when I had Charlie 5 years ago, he really taught me that as a field, we don't know what is typical in terms of like what are parents supposed to expect from feeding milestones. Like we kind of see it on the labels of this is food for a sitter, or we try to get some information from social media or our pediatrician, but oftentimes all of that advice is clashing and we don't have a good understanding of it. So I feel like he really taught me about just the vacuum of information and how confusing it is to be a parent in this field of feeding, something that we're all doing. And it starts day one, trying to figure it out. And then it just gets more and more complicated as we get older. And so then when it was time to have George, I was like, okay, I've learned a lot from Charlie. Like that's totally good. And then George was born a little bit early and emergency C-section. And he struggled with feeding right away. And I think one thing that he taught me was like, parents can't be the ones always saying that something's wrong. We know that something is wrong, and we can try to share it with our providers. And that's what I did. But I wasn't his best advocate because I was still very early days of having a baby.
Mm.
And so it took us a while to figure out why he was having challenges feeding. And that was like me as CEO of Feeding Matters, been working here for 11 years. And it really taught me that like we need to empower parents to have the tools to have those conversations with their providers. But we also need a society that can understand what pediatric feeding disorder is, and that it's not all this easy process for children to learn to eat. And then on the provider side, having some concrete tools that this is a real condition and we need to be looking at what's happening medically. He had a cow's milk protein allergy. What's happening feeding wise? He does have like a tongue tie that we like went back and forth on whether it was like kind of one of those in the middle that wasn't like an obvious answer.
The tongue tie wars are a different conversation.
A totally different
podcast.
conversation, but
Yeah.
it kind of plays into like how he was part of all
Yeah.
the different domains. And in the like psychosocial domain, I mean, he had reflux all the time. And so the psychosocial domain, he wasn't interested. And it was a whole process to get him to like eat and then go to sleep and do all these things. And so it really taught me a lot about like what we need to be as an advocacy and awareness organization.
I love it. It's really, it's so interesting what you said. We don't think about, and I think this is true of lots of childhood development, actually. We don't really spend a lot of time thinking about, unless or until something's going wrong, like how does a kid learn how to sit up? I mean, we just kind of prep them there and hope they'll do it at some point, right? And unless you're a PT, a physical therapist, or an early interventionist, you haven't thought about that at all. Part of the reason, one of the reasons I have this podcast is because it's only when things are going wrong that we are like, oh my God, this is really complicated. That's why it's called the Complicated Kids Podcast, right?
Yep.
Feeding is very, very complicated. And yet, when it's going well, it looks effortless. And in fact, right, human development, child development is meant to look like that. Like that's kind of how it's supposed to be.
Yeah.
When it's not, now we realize, oh my God, this is very complex and we got to look deeper. And so I'm really happy that you came on and very clearly and in a lovely manner explained kind of all of these different domains and how complex it is. Like I'm glad that you guys are looking at it in this way. It's a great thing.
Oh, thank you so much. And I know you had asked originally, kind of what is the difference between pick eating and PFD and RFID? And I think that's the problem is there's not clear answers. And I think it's just important that there is awareness that PFD is there. And I think on the ARFID side, knowing that there is this thing called PFD that significantly overlaps with ARFID is important to know, because ARFID is that psychosocial domain primary driver.
Yeah.
And oftentimes what children are left with after they maybe have grown out or figured out their compensation to these challenges. But both conditions are very complicated, very challenging. Feeding is really complicated. So
Yeah.
I appreciate you being open to sharing this information with your community, because, we're out there to support anyone. So if families need us, we're here for you.
And if people want to do that, where do they go?
Yeah. So we have our Instagram is at Feeding Matters. If you are interested in learning more than this, you can go to it's not picky eating as like kind of like your basics about
Oh,
ARFID and PFD.
you blinked out for just a second. It's not pickyeating.org.
It's not pickyeating.org.
Okay.
Yeah. And then we're always available at feedingmatters.org too. But we're really
Fantastic.
trying to raise awareness that what we're calling picky eating is not always picky eating.
I love it. I love it. I love it. Jaclyn Pederson, thank you for being here today.
Thank you so much for having me. I really appreciate it.